This is Fox 43 News
Excited, nervous, everything.
More than 50 million people suffer from acid reflux. There are all kinds of remedies out there to alleviate it, but there is a new procedure out that could possibly eliminate it.
That's right. Fox 43's Mederi Pan joins us now to tell us more about the new technique from a doctor that she knows very well.
That's right. Dr. Mark Noar, gastroenterologist from Towson, Maryland, has treated me for many years for my Crohn's disease, but he's also been working on a new procedure that's had excellent results in treating acid reflux. He and I sat down to talk about this potentially life-changing surgery. Over 50 million people experience acid reflux, and that's quite a lot of people. It's quite common, and we are joined by Dr. Mark Noar, gastroenterologist in Towson, Maryland. Tell us about reflux and what type of person suffers from it.
Sure. So gastroesophageal reflux disease, or what's commonly known as GERD, affects at least 50 million people in the country today.
Is this a result of bad eating habits, lifestyle, something you're born with? What causes?
There are many factors that go into this. We all typically are going to reflux throughout our lives, throughout the day. It would not be unusual, but certain things that we do make our reflux more often and more common. So for instance, caffeine, chocolate, alcohol, tobacco, peppermint are things that will make reflux worse. When we eat a meal within 3 to 4 hours of bedtime and then lie down, and so what's in your stomach literally ends up in your chest or in your throat throughout much of the night. And so those are the lifestyle issues.
Okay, what are the treatments? What have been the treatments, and then what, we'll talk about the new treatment.
So the typical treatments have been lifestyle changes. So we encourage people to watch their diets, lose weight. Obesity is a very significant factor, and that's why that's a big factor here. Stress, by the way, is probably one of the most significant factors out there. And don't we all have stress in the workplace and at home? So we counsel stress reduction, weight loss, watch what you eat. And if that doesn't work, people make their best efforts, then we can put them on different acid-lowering medications.
There's a new non-surgical procedure, correct?
Oh, yes, yes. Well, actually new. It's been around since 2000. And we've been recently fortunate to be able to publish the 10-year data. And that's something known as the Stretta procedure, which is an endoscopic procedure that takes approximately 14 or 15 minutes.
Quick recovery then, no downtime?
Quick recovery. And if you would like, I can show you what we're talking about. It's a really very ingenious device. And in fact, what the device does is it stimulates the sphincter muscle at the bottom of the esophagus, which is really the key to reflux. So the way it works is we'll put this down into the patient's esophagus, and let's see if we can get this to work here.
It's pretty long.
Yep, it's pretty long. The entire thing doesn't go down, just enough to get down to the sphincter muscle. And we have a syringe, and we'll put a little bit of air in the balloon, like you'll see here. And we blow the balloon up,
a little bit.
and then we use needles. And so here you see 4 needles
you can see those.
that will come out, and these will not harm the esophagus. They go directly into the muscle. And then we use timed 1-minute treatments, approximately 14 of them at different levels. And what this does is over time, over 2 weeks to 4 weeks, we start to see the sphincter muscle becomes very thick and it becomes very strong, and so there's very little reflux that comes up. And what we've determined over 10 years is nearly 50% of patients can go off of their medication.
Wow, that's great.
More than 72% of patients, even 10 years out, are no longer symptomatic. And it appears that after having had their Stretta procedure, we had 0 patients develop esophageal cancer.
Will they ever have to have this procedure repeated in years to come, especially if they go back to their regular eating habits? Is that a...
That's a great question. You know, about 2 to 3% of patients can come back anywhere between 1 and 8 or 10 years later and have the test repeated. So you can always repeat it.
Well, fantastic news for many people. I mean, there's obviously
really makes a huge difference.
Fantastic information for all of you out there who do suffer from reflux. And if you want more information on the Stretta therapy or Stretta procedure, you can go to our website at fox43.com. Thank you so much for joining us, Dr. Noar.
You're very welcome. Thank you very much.
So it is a non-surgical procedure, less than 15 minutes.
Wow.
And they do try to treat you with other medicines first before this. This is sort of a last resort, but at least it's an option because obviously 50 million people suffering.
I had no idea that many people.
Yeah, a lot of people.
Yeah, they sell a lot of antacids and a lot of over-the-counter prescriptions, and I find it fascinating, just those little needles. Just ting, 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 just strengthen enough to make that go away. Good stuff.
So if you want more information, of course, you can go to our website at fox43.com.
Thank you very much, Mary Ellen.
You're welcome.